Hey guys, Dr. Tim Uselton here with Trinity Integrated Medical. And in some of my videos, I've talked a lot about regenerative medicine, which would be primarily stem cells. And I've also talked about PRP therapy, which is the growth factor component of the regenerative medicine space, and platelet-rich plasma that we draw blood from you. Well, today's video, I'm going to actually explain why growth factor and stem cells are both necessary, why they work so well together. And I'm going to keep it real simple for you without getting too technical on the science. But if you think all the way back to when you were born, before you were born, at some point in your life, you were a single cell, right? You were an egg cell from mom and a sperm cell from dad that fertilized that egg, and then it was one fertilized egg. And then it rapidly began to multiply and divide into its many cells. And over 9 months' time, if you were a full-term baby, then you actually went from one cell, a fertilized egg, to over 100 trillion cells in a full-born baby, a fully developed baby. So how did it go from one cell to 100 trillion cells, which is too many to ever even count or consider, in only 9 months' time? Well, I'll show you how. In utero, in your mom's womb, there is an amniotic sac, right? So when she goes into labor, oftentimes women say their sac has burst, they've broken their water, and they know it because the water comes out, right? So it comes out, and it's not just water. It's called amniotic fluid, and it's inside the amniotic sac that baby is in. Well, also, down in the womb, there is a placenta, and the placenta is feeding all of the good stuff to this baby as it's forming from 1 cell to 2 cells to 4 cells to 8 cells to 16 cells to rapidly multiplying in minutes, right? And days and then months. Well, the the growth factors that are pushing that development are actually forming in the umbilical cord. Right? You got the umbilical cord that connects the placenta to the newborn, to the baby, when you cut the cord. Well, when it's just now forming, it's a teeny tiny little cord, and it's a teeny tiny little collection of cells. And very early on, within weeks, we've got a central nervous system. We start seeing heartbeats and stuff like that. But during that development phase, all of the stem cells are being produced in the umbilical cord and being transported out into the amniotic sac. And the amniotic sac is full of amniotic fluid, and the components of amniotic fluid include growth factors. So you've got growth factors in the amniotic fluid in the amniotic sac, and you've got stem cells in the umbilical cord that when they pair together, it's literally like a lock and key, right? So I've got a set of keys here, and this key right here on my key ring will go directly into one lock and work it and turn it on and make it work. Well, all of the locks, believe it or not, are the same. The stem cells are identical in every way to all of the other stem cells. Stem cells, remember, they proliferate, which means they make more of themselves. And then they differentiate, which means that they turn into different types of cells. One stem cell, when paired with this key, may make a nervous system cell. And then, say, this key, my mailbox key, a different key, might go into this same type and style of stem cell and go in and create from that lock and key a hair follicle cell. All the cells that are in our body are developed between a growth factor and a stem cell. The stem cells make more of themselves and then turn in with a growth factor to all of the other cells in our body. So that's the importance when you hear people say, well, I've got a stem cell injection. Well, most of the stem cell injections that we offer to clients to help regenerate knees and shoulders and soft tissue injuries, they have growth factor inside them, but primarily they work with the growth factor in your body already. You have the key, you just don't have enough of the good locks. And so we're putting in the stem cells, and those cytokines and kinases, which are the inflammatory markers that show damage or injury to your body, they're being produced because you got a bum knee and it hurts every time you walk downstairs, and it's screaming at you and your body's becoming inflamed in that area, and it's producing those cytokines and kinases. Then we load it in with a bunch of stem cells and it attracts all these growth factors to rebuild cartilage, right? And so, or some people have gone a different route and they've put in just a ton of growth factor to attract the existing stem cells to that area. What's amazing though is the cytokines and kinases know exactly what your body needs, and so it's never going to be injected into your knee and then wind up producing the structure of a shoulder, because it's in your knee and the growth factors know exactly what your body needs, and it actually will cause the growth and development of new tissue in the knee. One other important thing, when we talk stem cells and growth factors and regenerative medicine, most people have the misnomer that it's just repairing what's there, what's damaged. In reality though, it's putting brand new on. It's not going out to the street that has multiple potholes and patching up the potholes and then it's still just a repaired road. No, it's putting a brand new, fresh layer of concrete over the existing concrete, and you don't see the patchwork, the millwork, the repair work. You actually see brand new tissue, and that's the way it coats those joints. It reproduces that cartilage over those areas that are damaged, and now it's no longer damaged. So we've seen great success in our regenerative medicine products and program here at Trinity Integrated Medical. So I just wanted to again touch base with you, explaining the difference between growth factors that are found in your platelet-rich plasma, as well as produced in the umbilical fluid, the amniotic fluid in the amniotic sac, and then the stem cells that are produced in the umbilical cord, that when they get together, they go to town and make a baby. And 100 trillion cells later, in 9 months' time, you got a perfect functioning little human being. So that is, in a nutshell, the difference between growth factors and stem cells. And if you have questions or comments, be sure and leave them. I appreciate you watching my videos, and there's more to come, so stay tuned, and I hope you have a blessed day. It's Dr. Tim Uselton with TrinityIntegratedMedical.com. Thanks so much.